Hello, I'm Jermaine Williams, President, Montgomery College. It is an absolute pleasure to welcome you to the next episode of Next Gen Talent. Let's get to work. A fantastic guest who is here with us today, Dr. Anthony Stahl, is here, and he's going to share just some fantastic information about the present and the future. We've already been talking a little bit. I'm going to enjoy it. I know you're going to enjoy it. So thank you again for being here with us. As I mentioned, Dr. Stahl is here. He is the president of Adventist Healthcare's White Oak Medical Center here in Montgomery County, and he is a dedicated partner with Montgomery College. And I can share that one of my most memorable moments in the first year here at Montgomery College was when we signed a lease for the East County Education Center. And Dr. Stahl was there. As a current and future partner wanting to build relationships, speaking on behalf of what we can do for our community, both now and in the future. So I can testify that he is definitely dedicated to the partnership and advancing healthcare here in Montgomery County. We're just so delighted to have you here with us, Dr. Stahl. Thank you very much for being here today.
Well, thank you, Dr. Williams, for this kind invitation to share some moments with you and your listeners on Next Gen Talent. Let's get to work. And can I just say right out of the gate, we are grateful for your leadership and that of Montgomery College in really preparing the current and future generations in the workforce. I think it just really abides by your mission of truly empowering students to change their lives and to enrich the community. So thank you.
Thank you. Thank you very much, Dr. Stahl. Today, you may have noticed that we are here in our Health Sciences building and home to an array of programs. In this location, you'll find the ability to become a nurse, a physical therapy assistant, a sonographer, surgical assistant, phlebotomist, or radiology tech. Just a wealth of healthcare professions that you can engage in state-of-the-art facilities here at Montgomery College. We are specifically sitting in one of our nursing labs, and even more specifically in front of two sim human beings. So this is a fantastic opportunity. They are live and operational. They are breathing. They are blinking. This is a very exciting environment to be in. So you'll find these types of labs and others where our fantastic faculty instruct and engage students to develop the skills that they need for today and for tomorrow's healthcare needs, to the points that you just made, Dr. Stahl. So we want to, as you shared, create a local talent pipeline, a homegrown pipeline. We are the community's college. We want to see the community thrive. And as you mentioned, that is our mission, that is our goal. That's what we've been doing for 76 plus years. It's what we will continue to do. So let's get started and talk about how we will continue to do this, and primarily, obviously, within the healthcare field focus. So when we talk about workforce needs in the healthcare field, right? And we say, and I'm new to Montgomery County, and let me share with you and everyone that I feel just really safe. I mean, it's just the number of hospitals, emergency rooms, doctors' offices, rehabilitation clinics, nursing facilities, urgent care facilities. As someone who's kind of aging and have two small children, it's great to be surrounded by so much healthcare support. With that said, we know that across the nation, we have a dearth of actual individuals, workers, right, who need to fill essential roles in these facilities. And Montgomery County is no different. So healthcare employers like Adventist, have job openings that just plainly put, they're going unfilled. So when we think about that and the fact that we know we need skilled workers, yet there are not enough skilled workers out there to fill the roles that are needed, I just like to hear, and I know our audience would like to hear a little bit from you, is like, how can you help us, and please help us better understand and grasp what the situation is with workforce shortages and how does that affect the healthcare industry. And we know that, we were just talking about this before we started, lack of nurses, right? That splash headlines everywhere, but this is hitting other professions in healthcare as well. So if you could talk a little bit to those questions, it'd be great.
I'd be happy to. Let me just set the table in a macro sense.
Please.
So if we look worldwide, within the next 7 years, our world will have a deficit of 15 million healthcare workers. That's 15 million across our globe. Now we come to the US and we know that the pandemic just frustrated the whole issue with the workforce. In 2021, we had the Great Resignation. And I was looking at data just yesterday. Now the data keeps coming in, but the data I'm reading suggests that 47 million individuals resigned from their job in 2021, globally, across all work spectrums. In 2022, about 15 million or 50 million resignations. Now, within the first 2 months of the pandemic, 1.5 million healthcare workers were eliminated out of the workforce. And what we know is about 20% of the healthcare workforce in the US left the healthcare because of the pandemic. So there's across the spectrum, it's not just nurses. You can go down a long list of healthcare jobs and see that across our nation, there are literally thousands, if not hundreds of thousands of vacancies today. So just an example, in Maryland, we have a deficit of 5,000 nurses today. And that really creates huge challenges. As Adventist healthcare today, we have 300 openings for nurses. Now you asked another important question. How does that affect healthcare? Well, across our nation now, the whole term of healthcare deserts is coming into effect, where there's whole populations that aren't properly being served in healthcare. Here in Maryland, as you say, we're fortunate to have great healthcare, just a plethora of hospitals that do a wonderful job. But when you lack the workforce to do the job, often it can get harder to get in. It can take longer to get into a hospital or urgent care. Of course, in the ER, it is wide open 24/7. Never would turn anyone away ever. It lowers morale when you're carrying a heavier load. Also, quality can suffer, and patient satisfaction. So not having the proper workforce, the right number, it's a real challenge. And when we think of hospitals, just to answer that final part of your question, I mean, we're not just hiring nurses. We have respiratory therapists. We have lab technicians. We have pharmacy techs. Then let's even broaden it farther out. We need marketing experts, human resource experts, financial experts, analytics. The list is long, and in every one of those areas, it is taking longer to hire. Right now, the average nurse, it takes about 3 to 4 months to fill a position once it opens.
Those numbers are just startling. And the impact on our society is just really causes extreme pause when we think about, living a healthy life. Right? We think about access, quality healthcare, and we think about equity. Right? So, I mean, this is so many factors that are being impacted by what you just shared. It's I know we could dig deeper into that conversation. Let's take that, and we talked about the different roles, and it kind of probe that a little bit, and job skills that are needed. And you've clearly identified that the need for skilled talent in health professions is a big challenge for multiple reasons. You mentioned the resignation part of it, low morale, right? There's the bandwidth piece. There's the time to actually get someone hired. There's all of these components, right? Specifically about jobs at an MC, we pride ourselves on being a fulcrum for the creation of local talent, right? That's what that's what we're here for. That's what we strive for day in and day out. While we were built, that's and more specifically homegrown talent. And when we think about that, it means we work closely with employers, right? And that's our primary goal, because everything we're doing is somehow leading towards workforce, right? Our faculty know that it's critical to prepare our students with today's most relevant skills. And when we think about that and students being ready to succeed at the jobs that are out there, not just nurses, not just respiratory, but everything that you mentioned, really would like to know from your perspective, talk a little bit about the changes that you're seeing. Right? So we talked about the need for jobs, and it's talking about the skill development that's there because we want to continue to partner as we have been with employers. So what changes are you seeing in healthcare, and what are the careers that residents can access with the appropriate education and the kind of pathways that are available? So kind of digging into that a little deeper, because you mentioned several different kind of jobs that could be careers in themselves.
Right.
So what's the first step? What's the pathway? How do we get there, and has any of that changed? Because we were talking about that earlier. Well, we used to think that this was the path, or you just jumped into this, but wait a minute, you can start here and then be here and be there, and next thing you know. So a lot going on with those couple of questions, but would really like to hear your thoughts.
Great questions. And as our world is changing rapidly, so is healthcare. And we will need to start training today for tomorrow, because tomorrow will be very different than today for our workforce. And we are seeing what's coming into healthcare rapidly, artificial intelligence. It is coming in quickly, rapidly, and it's here to stay, and it will revolutionize the healthcare model. Technology is changing rapidly. I mean, give you one example. We have a Da Vinci robot that does surgeries. It was invented in the military with the idea that a surgeon could sit in New York and operate on someone in the field 2,000 miles or 5,000 miles away. We have that capability now, but that will just increase and become much more accessible. So there will be new jobs coming into the market that we don't even have today. Jobs helping patients interpret the data. Wearable devices, very soon, there'll be worldwide over 1 billion being worn, with collecting data off of individuals. So to have someone sit down, not necessarily a physician, but to explain all that data that from this device that's collecting from your heart and everything else, it will be important. Career paths are so many. I would encourage our local residents, find opportunity to shadow. As you get in and shadow, you're going to see careers that look so exciting. Internships are important. I would encourage our residents to come to Montgomery College. What you are doing here is phenomenal, and I can tell you from our nursing teams, our senior leaders, they value the nurses that come out of your program. They're incredible. So continue to study, shadow, and stay engaged.
Thank you for that very insightful and fascinating piece. The Da Vinci surgeon, the Da Vinci robot. Yes. So it's giving us a little insight into both the present and the future, and then those very practical next steps for our residents of about shadowing, inquiring, coming to Montgomery College to find out more information. Really appreciate that, Dr. Stahl. As we think about partnerships and we probe a little bit more in looking at the college and connecting with employers from all industries, and we have wonderful partnerships, as you've mentioned, including with Adventist, which we're very, very happy about. And the idea that these partnerships are facilitating learning for our students, and this intentional employer engagement with our faculty, it enhances our curriculum. We're just really excited. I said this before about the partnership in East County. Right? Mm-hmm. That we're neighbors, yes. Right? We look over and get to, I can wave. And then so we're for the East County Education Center, and then what will soon to be, well, within several years, an entire campus, right? So I think when we think about these ideas of artificial intelligence and these pathways, is how do we build an entire new campus with this in mind? And so that kind of leads to my next piece, right? We have this idea, right? This wonderful, fantastic opportunity to build an entire campus, right? And a part of our county that we know needs to be served in a different, more equitable way, right? What ideas do you have about that? How does that partnership look? How can we identify, deepen, strengthen what we're currently doing with essentially a blank slate, with all you know about artificial intelligence and pathways? Would love to hear your thoughts, because this is just literally like a blank canvas. We can do this. What do we do?
So the sky is the limit. Some ideas I just come to mind. You know, currently we operate a very sophisticated research department at White Oak Medical Center doing research for the FDA, and these are very sophisticated projects. Why not involve students in some of that research? They get their feet wet in research, and then it opens up a whole world of career ideas as they're doing research. I could also think of hospital team members coming over to the college as a visiting guest lecturer. That could just give additional perspective on what's going on today in healthcare. Of course, I think scholarships. I mean, that's a great way to partner. I know many hospital facilities are partnering with you in that aspect, and it's important. We need to, looking at that whole issue of equity, we need to ensure that we have that equity, and that finances aren't a reason why someone isn't getting into a good program like Montgomery College. I just think the sky is the limit. It is unbelievable. Internships. So what about internships? Mentorship programs, which are very different than an internship, that could really facilitate a step forward in a student's career.
Thank you for that. Off of that, what do you think about when the whole AI, AR, VR world is just, it's extraordinarily fascinating, right? Sometimes we think about how we inform and engage our residents into or with fields that they may not even know exist. So we think about, how do we go deep into Montgomery County Public Schools, right? How do we engage that grader, sixth grader, seventh grader? I'm just wondering, what your mind considers with the idea of AI, VR, AR in terms of engaging residents earlier. So not only do they know that these professions, these fields are out there, but they can probably see themselves doing it, either like figuratively and kind of literally in an AI world maybe. But how do you think we can utilize technology to go deeper and reach people sooner?
Great question. It brings to mind this study I was reading years ago that said young kids that came up playing video games were incredible for the military in flying drones. So I think as young people come up through grade school and high school, that whole issue of latching on to technology, it's going to help prepare them to be ready to on this field than I would even be able to in the healthcare industry. I mean, just stay with technology, stay with computers. There's such a huge connection to the healthcare field, and learning it early in grade school and in high school, I think, makes a huge difference.
Wow, I wonder if that was actually designed, because now you have me thinking, what if kind of gaming and education and healthcare got together to actually create an enjoyable game that was going to prepare, as opposed to it happening out of a happenstance.
Right.
I don't know if it was designed, but what if it were designed that way and actually preparing students for that? And maybe it was, but I just wonder, just now you have me thinking, and I'll get back to the actual questions. We're having such a good conversation.
But Dr. Williams, there's no reason to think, why not create some fun games, fun technology that relate to healthcare that young people would say, this is fabulous. We're having such a good time playing this, and it really will prepare the eye-hand coordination, the way that, the way you would need to think will change radically in healthcare as time goes on.
All right. So action item. We'll talk.
Sounds good.
We'll talk after the dialogue. So when we think about that, because that is actually, segues into the question in terms of meeting student, employer, and patient needs so we thrive. Right.
Mm-hmm.
In order to do that, we need the workforce. We need people to understand what they're getting into. We need them to be engaged. We need them to be excited about it. So I think that conversation really does segue into this piece, talking more about collaboration, right?
Mm-hmm.
Responding to healthcare talent crisis and giving more residents access to meaningful career paths, right? With the form these unique partnerships, maybe that we were just talking about. Who knows, right? When we joined, one kind of instance of this is, we joined a primary care coalition and Nexus Montgomery that Adventist is a partner of. Together, we secured federal funds, right, with immense help from Maryland's congressional delegation. So very thankful for them as well. And these funds are actually provide no cost, low cost education and training for Montgomery County residents, right, in the healthcare field. And it was just a win for everyone. We're getting more lab space. Residents will get scholarships. You mentioned as that being advantageous for themselves. Hospitals will gain ready professionals that reflect patients who they want to serve. So it's just all, and residents also gain optimal care. So just a kind of a win all the way around. And we think about that in terms of that partnership piece that we were just talking about and deepening and strengthening. Are there other ways that, and we just talked about one kind of off the cuff, so whether expounding on that or something else, but are there other ways that the healthcare industry and post-secondary education can collaborate so we can create new ways to help residents get the credentials that they need for meaningful career ladders, right, while closing workforce gaps?
Oh, great question. 50,000 foot level, right. I would say that if hospitals, acute care hospitals, and colleges could create some type of advisory board where like-minded individuals would come together to discuss this very question. So it's more intentional than on the run thinking, how do we get this done? But you're coming together in a way, and at this advisory board, to develop additional ways that our local citizens can get the certifications or the career path. Of course, other areas that could help be grants, workforce development grants, which we're fortunate to be located where we are in our nation, and I think we would have access to that. Again, internships, mentorship is important.
Thank you. So. That sounds like a great conversation and collaboration to be there at the forefront, having that dialogue, right. what that looks like. So thank you very much. I think we have a few more moments, and we have a question or two from the audience.
Okay.
So our first question, what is your advice to someone who wants to change careers to become a healthcare professional, Dr. Stahl?
Oh, it's never too late to change careers. Never, no matter what the age. I just saw this physician graduate, and he's in his late 60s. I think 60s, of course, the new 40. So it's never too late. And I would say explore what you really are interested in healthcare. Don't go into it for the money. Go into it because you really have a passion and you care about other people, and you will never go wrong. So I would say, work with a career counselor, do the research, shadow, know what you want to get into, and go for it.
I love it. I love it. Never too late. Follow your passion, right? And work with someone to identify your path, and you'll be golden. That's what I kind of. That's fantastic.
Well, and I was just reading an article about this. A hospice nurse did some research on what their biggest regrets, end of life. And one of the 5 biggest regrets is that they didn't follow their heart, that they were always trying to please others, they were always trying to do what they thought the crowd expected of them. And so let's not have regrets. Let's take that step. I think do it cautiously. You know, I don't
Yes.
know what the audience, what their, you know, this person's financial situation is. So if you're in a job, you may need to study nights, and it may take some sacrifice, but you can get there.
That's
So.
fantastic, fantastic. Well, I think we have time for one last question. What are the top qualities or skills you want for healthcare professionals you hire?
Oh, that is beautiful. You know, you can train people for skills, but there's attitude that makes all the difference in the world. When I'm talking to someone, I want to know, at least for our hospital, are they mission driven? Do they care about our mission? Do they have integrity? Are they people who want to work towards world-class care? Are they going to be owners, not renters? Are they striving for excellence in everything they do and good stewards of the resources they have? Those are attributes that, to me, are very important as we look to the future.
That's really important to know. And I hear the passion coming through. Again, I hear follow your passion with the previous question. Your passion is what you're looking for, being dedicated to the mission, and those components are so salient. Like as we close, I just want to provide an opportunity. Do you have any final thoughts that you would like to share with our guests today?
Well, again, thank you for this wonderful invitation. I would say a final thought would be, and it's something we're focusing heavily on at White Oak Medical Center and Adventist Healthcare, it's this whole concept of self-care. We can give nothing unless we've taken care of ourselves first. So that whole thought of self-care, you know, you think in an airline industry, they talk about bring down the oxygen mask first to you and then to your child. So you need to take care of yourself. And so I would encourage people, take care of yourself. Find that time for you every day. And you'll truly be able to then give to others.
Thank you for that. I know as something that I work on a daily basis. And I also share your sentiments of how important it is. And it is great to get that reaffirmed by someone who's actually in healthcare, who knows a lot more about this than I do. So it's great to hear your sentiments and how important self-care is. So thank you. Dr. Stahl, thank you so very much for your time. Again, thank you for your partnership, both in the past and the present, and what we know will be a wonderful future. And I'd like to thank our audience today. Thank you for joining us. Thank you for participating and asking questions. Thank you for being dedicated to the present and the future of our area here in Montgomery County. And I look forward to seeing you at the next conversation of Next Gen Talent. Let's get to work. Thank you, everybody. Have a great day.